Hi, welcome to our show, Connecting the Community with Chris. We have an exciting podcast guest today from Open Arms Hospice, Vilya Lilinski. Welcome.
Welcome. Thank you, Chris.
So happy to have you. So tell us, Vilya, how did you get into hospice care?
Well, Chris, thank you for asking that very important question. My hospice journey started about 6 years ago with my father having hospice and with another hospice company, and I learned more about hospice and what the importance of hospice was. But one thing I learned out of that journey is how important it is to learn about hospice early on so that you could provide the resources for the family like myself as I was going through taking care of my father. If I would have had those resources ahead of time, I would have started the hospice journey much earlier and provided him more levels of comfort and care and provided myself some time to be able to spend quality time with my father. So, yes, my hospice journey started about 5 years ago. And I've been actually working with different hospices in the last 3 years. It started coming back as in the community liaison to educate individuals in the community about hospice and the importance of hospice and starting having that conversation early on so families are equipped with the resources they need.
That's great. I feel like a lot of our caregivers and individuals in the community, they had that experience with their parents. If it's not, it's maybe, a friend or a family member or a neighbor. And that inspired them to be able to care for people. And so, that I believe it could be one of the best type of experiences you could ever go through, and the gratifying feeling. And the best caretakers really feel gratified that they're able to be in that position to be able to care for that individual. And so it's really a blessing, to be able to feel that way, but also do make it your career. And so, to wake up every day to know that, you are caring for someone, that's your purpose. You're trying your best to do that. And also too, is it's actually your job, you know?
Absolutely.
And so you know, I commend you. And I think it's really great. And I know you for many years that you're really great at what you do. So, um, tell us, and the public right now is that what is the definition of hospice care?
Wow, the $1 million question, right? Everyone wants
Yeah.
to know. Yeah, what is hospice? I often that topic gets confused. Most people don't want to talk about it. As you know, when you go to social gatherings, who wants to bring up the topic of hospice, right? They have that fear, that unknown, the anxiety. Uh-oh, hospice, end of life, right? Taboo. But it not necessarily, it doesn't have to be that negative tone of hospice. Hospice has so many benefits, has so many resources to support the family and yourself as you're going through the end of life care. And as long as we have education out there, we can provide that to the families. So hospice care is a type of health care that focuses on the palliative care of terminally ill patients who usually have 6 months or less to live, and it assists them with the pain and comfort management, pain and symptom management, attending to their spiritual needs, their social needs, their end of life needs, and they also provide comfort and support and grief support for their families as they transition. Because as you all know, Chris, it's not just the individual going through hospice care; the whole family walks with them alongside.
Absolutely. Ugh. Everyone is usually typically taking care of their loved one before they even reach out to have any type of care. That's how it is with any home care or hospice care. Family members are being involved and they're helping as much as they can. But I know that with hospice care, it could be a little different. During those last days, it's good to be able to delegate that services so that way you could spend the time with your loved ones. But how do you know when someone is actually eligible when it's time to actually receive hospice care? Um, how are they eligible to actually receive hospice care?
Well, okay, it's a good question. Again, with hospice, there's a couple of determining factors. So hospice has to be, first of all, you have to be diagnosed with a terminal illness of 6 months or less of your prognosis of your end of life care. And that is usually determined by your medical primary care physician. And then you also have to ask yourself, do you want any more curative treatment with that? If you deny yourself curative treatment with that alongside of the hospice, then you're definitely eligible to qualify for hospice. And the doctor will do the evaluation. He will provide you the qualifications for entering the hospice. And then they would work with the hospice medical director on staff, and both of them will determine are the qualifications needed for hospice care. Again, the main purpose is to have a life limiting illness of 6 months or less with the prognosis of end of life care. And it would be a disease that could be like cancer, any of the long terminal diseases that we have today. So that's basically what it starts with the doctor's referral, physician's order, and then from there on, they include the whole interdisciplinary team. Now, the
Mm.
interdisciplinary team consists of the physician, the hospice medical director, the nurses, the social workers, the spiritual care team, the bereavement team, the grief counselors, other therapists, like music therapy, pet therapy are vital aspects of this team. And most of all, our volunteers. The volunteers are a big component of this whole team to help support that extra layer of support and aids.
So let's paint the picture for everyone so that I understand is that what can they expect from all these disciplines that are coming in and care professionals coming in at one time? Are they scheduling time to come in? Is there scheduled appointments, and how long are they typically? Can you give us a little what type of experience are someone going to go through with all those professionals?
Great question, Chris, again. Thank you. So so there is a care plan upon the referral process starting. There is usually an individualized care plan that's created by the interdisciplinary team. And this team composed of all these professionals that I mentioned, and they just sit around with the medical director to discuss and figure out what is the best ideal care plan for that person going through hospice. And again, it is scheduled appointments. They will come in and do visits. So aides will come in possibly once or twice a week to give showers and attend to those shower needs and daily medication review needs for the patient. The nurses will come over and review to make sure that the patient is in comfortable position, is in managing the comfort pain management symptoms. The doctor will review all of that as well in the care plan. We have social workers who are advocates. They come in and help support the family and the patient to help them promote and get additional resources and support in the community to help facilitate that process of what's needed to help them for their end of life care. And
So,
then, of course, the volunteers help support the families.
and some of these care professionals are coming in at one day. Like, so 2 or 3 are coming in one day.
Correct.
So,
There's scheduled appointments, but they can come at different times. Mhm.
yeah, at different times. So, really, no one's alone during this
E
process.
Exactly.
You're not alone, and when you are caring for your loved one, and when you are limited on resources of individuals to help you, whether it's friends or family, you don't have to do this process alone. There's
Absolutely.
always someone coming in.
Absolutely. And it's the layer of the team. They are there to support and guide you through this whole navigation of the process of end of life.
Now, do you guys provide around the clock care, or is that not of scope of care that you guys provide?
So we are available 24 hours,
Okay, so
but
someone can call you and and talk to someone, a human being.
yes. So
Okay.
as you know, hospice care is available on call after administration offices are closed 7 days a week and 24 hours a day. Most hospices have nurses available to respond to a call on call to help with any questions of critical care, and the nurses will respond. So we're there to help assist and determine if our nurses need to be sent out to assist with the pain management 24 hours of care.
Yeah,
Some hospices programs even have chaplains that come out and social workers as well on call. So we're there on call as that extra layer of support. And we
great.
this is but we also were then so I want to differentiate that. We're also there available 24 hours, but we're not there present 24 hours. So
That's
we're
what I was gonna get to.
available.
So you're available to consult, coach, educate, and provide when you can on a scheduled visit, but someone's not there all day, all night.
Correct. So we're available 24 hours, yes. If
Yes.
they need to be to call us with
Mhm.
questions, with coaching, with pain management, our teams are there to help. But
So
we
what
work
if
closely
someone
with home
needs
care. I'm sorry.
Yeah, so what if someone needs someone there, round the clock and the times that you guys are not scheduled to be there? Now, how does home care fit in this type of scenario when someone's receiving hospice care?
Yes, another great question. So yes, this is where I was going to get to. So home care, it plays a big vital part in this picture of working with hospice, and that's why a lot of hospices or all hospices work alongside home cares, private duty home cares, to assist with that additional layer of support and care. Because as you all know, our general team comes in, we're available for consult and to help out with pain management, but we're not there in the house 24/7. Therefore, an aide, a home care agency will provide an aide that will come out there and be there within the 24-hour shift if needed, or during the shifts that the patient is required or is of need. And we will work closely with that aide to provide them the tools, the resources, the education they may need to help support that extra layer of support for family so that the patient is feeling comfortable and their symptoms are being managed, appropriately, and the family's feeling comfortable as they transition.
Yeah. Okay. So what happens is that they're having scheduled visits. The doctor writes a script and oversees the care, and so all the care professionals on your team are coming in at the scheduled time to be there for the family. Now, when your team leaves, caregivers typically come in. Home care comes in and usually helps out with the activities of daily living. You know,
Correct.
the personal care, the hygiene, the medication management, the mobility, helping with mobility and transferring and moving around the house, pretty much anything that needs to fill in the gap where, say, a family member wants to leave the house, and take a break, or has a doctor appointment. Or, hey, they might want to make it to their kid's baseball game. This allows them to be able to delegate their time during the process when their loved one is at home and when they need help. So what are the benefits for a person that is affected and needs care? What's the benefits of receiving hospice care?
So the benefit thank you. So
Of
the
the person
benefits
of the actual client, the person that's actually receiving it.
Okay, so thank you. So from the actual individual patient who's receiving hospice care and is eligible for hospice care, the moment that they sign on hospice, they receive the additional, first of all, pain management and comfort care. That's the key thing because, as you know, through the dying process or the end of life process with the disease, our body changes, and we often go through changes in physically as well as emotionally through the changes as we end of life. So it can be very painful, it can be sudden, it can be uncomfortable. And so our team comes in, medical team will come in, which is like the nurses and the doctors, and they'll manage and they'll create a plan to figure out how to manage those symptoms, correct? To the end of care. So that's where the benefits will be, their symptoms will be managed appropriately according to what the family decides and what the individual who's going through the process what he feels or she feels would be most appropriate. Then the patient, another layer that the patient will feel or will be able to receive is like music therapy. Now we're talking about the spiritual and the emotional side of hospice and of the individual. So bringing them at some comfort by listening to some soothing music by a professional music therapist at the bedside. That is an amazing experience that an
Love that.
individual will receive. Or pet therapy. As we know, pets are near and dear to us. Pet therapy is another addition that we can provide to help support that extra layer of comfort for the patient.
And I've sat in rooms where music therapy is, and it's truly inspiring. It's so nice and it's soothing. Sometimes the client, can't even, communicate anymore, but they can hear. And so
Mhm.
it's good to make sure that we always provide them with dignity during this process as well, too. And
Right.
playing their favorite songs is really great. So knowing their interests and talking to their family members during this process, that helps. And also I've seen pet therapy too. We all know we've walked in the hospital and seen actually the, animals or dogs usually walking around. And so there's actually a really good positive mindset shift when seeing, a dog come in. Um, I think that's really valuable for the client receiving care, all of the services that you provide. But what about the families? The
So now
families members are also receiving, care too, in essence, in the long run, in hindsight, big picture. So, how are the family members actually receiving benefits? receiving hospice care?
Excellent questions. Absolutely. So, as we all know, not only is the individual going through this hospice journey, but the family, the unit itself is going through this hospice journey together. And as you know, they have, we all experience fear, anxiety, the unknown. You know, let's face it, we're all going to die someday. But how we do this, how we prepare for our end of life is our choice, and how we can be empowered to do that, to make the choices that will be more comfortable for best for ourselves and for our families. So what the families go through is they're able to get that extra layer of support for grief counseling. Social workers will work closely with them to provide additional resources for them, so that they, as they get educated and learn how the grieving process starts, when does it start, how to navigate those feelings, bereavement as well after death. So in fact, there's bereavement teams that can be serviced after the individual passes for up to a year, will be covered to help support those types of transitions. So the family receives that extra layer of spiritual and grief counseling as they go through this transition.
It's so nice. I swear, I can imagine, Vilya, you waking up every day feeling blessed. The type of services that you guys are providing family members, and also the client at the same time. I know being in home care is that there's nothing better than a family member after someone does pass away and they contact you, and they really are so super grateful for you being part of them during this process and making things a little bit more easier. And so that is really great. There's a lot of people that are affected, but also too there's a lot of individuals that you are helping too at the same time, not just the client but the family. How long is typically hospice care received, and is it coordinated? Is there a statistic where typically someone can actually not be on hospice? I've heard the word used throughout the years is that they can graduate from hospice, right? Which means that they can have hospice care and then and actually stop hospice care. So can you give us a little example, like just a little like of like how long is the process typically, they say, to receive it, and can they actually get off hospice and move on?
Yes, and thank you, Chris. And we've got to be very careful on how we use the word graduated, because they technically, well, people use that term loosely, but they technically don't graduate. They just, they're part of their disease is they're not declining according to Medicare guidelines, is where it should be at their points. So they might be at a standstill, or at where they're at a plateau. And that's when the doctors will come out, and the medical team will be evaluating and
Yeah.
assessing them, and
Mhm.
according to Medicare guidelines and benefits, because it is Medicare is one of the benefits for or hospice is one of the benefits for Medicare, and they will be able to cover that, and be able to help support the families to provide that extra care that we talked about earlier. So usually it's a 90-day period, and it's two 90-day periods, where that's where that 6 months end of life care, right? We always
Mhm.
determine it's about 6 months or less. So the
Yep.
two 90-day periods of Medicare, under Medicare guidelines, that would be the evaluation period. Now, again, case by case.
Is that evaluated at the 90th day? And then
Correct.
if there is another episode of another 90 days,
Correct.
and I'm assuming you're saying that has to be a decline.
Correct. It has to
Well,
be significant. It has to be a decline
yep.
of
And if they
true
don't see a
degradation.
decline in the individual, then they might say, let's hospice care is, doesn't insurance is not going to cover care.
Correct. So at that time, the team will then reevaluate. They would stop, if there's not a significant decline according to the assessment and the evaluation and Medicare guidelines, they will then discontinue the hospice care temporarily, and can revisit after 60 days. And then at 60 days, they can go look through that, or 90 days, and they can look through that and determine the next, because sometimes there's a significant fall, or a new diagnosis that brings it more of a declination in the progress of the disease.
So if someone was going in for who has cancer care and receiving hospice care, and then 90 days are up and there's no decline, but then the client's walking around their house and they fall. Now, can they still receive hospice care because of the fall?
So it would have it still be determined by the assessment that is done by our professional team, the medical doctor specifically, who will come in and see if this is a new, under the Medicare guidelines, the new
Mhm.
qualifiers for a new now a new
Mhm.
condition, a new diagnosis. But it has to be showing in conjunction with the terminal illness and end of life care. So they will assess that. Our medical team will assess that directly, and they'll be able to use those qualifiers to see if an individual is able to still continue on hospice or need to be
Yeah.
reevaluated for a later date. Now, again, it's case by case with the 60 days, and it's usually additional 60-day periods if they needed to be considered for like careful evaluations of the more in detail evaluations and assessments by the medical team to
Mhm.
make sure that their end of life care, they qualify for the end of life care because Medicare has stricter guidelines.
Now I've seen people and individuals who had, home health care after a fall. So if they were ended hospice care and there wasn't a decline and they did fall, they possibly go in the hospital. They could have hurt themselves and then need some rehab or exercises to gain strength. To gain some strength and range of motion, and so then they could have a therapist or a nurse come in the meantime to be able to help them, and then helps the family members to receive another kind of care professionals in the home. Have you experienced that before?
So in my previous experiences, yes, I've seen that happen on case by case situations. But again, it goes back to the team, the medical director specifically, the doctor,
Yeah.
who's the hospice doctor, and he will then determine and
He overs
evaluate the
So
situation.
he's the one that will write that script and make that decision what's going to be best for that individual
Well, he will
that
be
was on
determining.
hospice with them.
Correct. So he would determine then if we need to, at that point, they need to consider and be consulting another physician for future needs, or is this individual still qualified under the hospice care?
And so, how should a family member begin inquiring about hospice care? What's the first thing to do to be able to contact an organization like yours?
So, first thing for like example, Open Arms Hospice, we have this brochure here, and you can reach us directly at, if you want to see this right here.
Mhm.
Okay.
Yep.
You can reach us directly at our main number, which is 248 516 3978. Again, 248 516 3978. We're located here on 10 Mile in Novi, and you can contact us directly at the main office. Our team will be able to help assist with the referral process to get the admission started, or you can contact one of our community liaisons or account managers like myself, and we can assist you with that process as well.
I love your owners. I know the organization for a very long time, and I'm very grateful to know you and that family that opened up Open Arms Hospice, and all of our family members who ever received care through your organization have been truly blessed to be able to have you guys in their home.
So I just want to leave the audience with a small little mission point and mission statement that is so near and dear to my heart, but as well as to our hospice family at Open Arms. So our mission is to honor life and to offer care and comfort with dignity in order to ease the burdens of all patients, caregivers, and families, and during the challenges of severe and progressive illness. We as a small family, an Open Arms Hospice is a smaller hospice, but because we're so intimate and we're a family oriented hospice, we really truly hold high quality standards of this mission. We provide the highest quality, the most I guess, compassionate, passionate care because we truly believe in this mission, providing the individual and the family with the highest dignity, respect, and honor through their end of life journey. And so I want to leave all of you with that quote and an additional for resources for the families as well as for the individuals who are maybe considering hospice care. We have these wonderful resources we do help give to families to help make these decisions a little easier to discuss. And this is one is when are you grieving and what do you do and how do we process grief? The other one is when the death is near, how do we deal with it? When do we
Mm,
have that conversation?
mm. Those are really good resources. And so if anybody wants to have that, they can just call your office, right?
Absolutely.
That's wonderful. That's great. Well, thank you for so much for your time. We appreciate you. And so stay tuned for our next podcast with Open Arms Hospice. Thank you, Villia. Appreciate you.
Thank you, Chris, and have a great day.
You too.